Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. We're joined tonight by Dr. Anita Kurian, who is our Assistant Director of Metro Health, and this is our COVID-19 update for the San Antonio community. Tonight we're reporting an additional 192 new cases of COVID-19, which brings our total number to 201,010 since the pandemic began. Our 7-day rolling average is down slightly to 174. Sadly, we do have one new death to report tonight. A Hispanic female in her 70s. We have lost now 2,991 neighbors, friends, and family members to COVID-19. And remember, as we have said every evening, every single one of these numbers is a family member who has been mourned over and lost in the most tragic of ways. So please keep their survivors, their friends, and families in your prayers this evening. In our hospitals tonight, our downward trends are continuing. And that is good news. 206 COVID-19 patients in our local hospitals this evening. That continues the positive trends that we've been seeing over the last few weeks. Over the last 24 hours, there were 31 new admissions. 84 patients are in the ICU, and 47 are now on ventilators. Remember, again, that our fight against COVID-19 is not over. We are working very hard to get more vaccines into this community and keep pace with the amount of transmission that is occurring in our community. It's very critical right now, as you have seen variants in other communities begin to turn their numbers around, not in a positive way. We do not want to have that happen here in San Antonio, so please continue to do your part. Practice social distancing, wear your mask, and proper hygiene as well, and we can get to the end of this pandemic together. Quick update on our overall vaccination numbers. As of yesterday in Bexar County, according to the state DSHS, Bexar County has seen now 369,379 people who've received their first dose vaccine, and a full 206,778 people are fully vaccinated, and that is all great news. We want to see those numbers come up over the next few weeks much more quickly, though. So let me turn it over now to Bexar County Judge Nelson Wolff.
You know, when you're talking about the vaccines, we're not going to get things done as quick as we want to get them done without the state getting us some more vaccines. With 206,000 with the second vaccines, I think we have a population of about 1.6 million over 16 years old. But we're still hampered by that. I think the President of the United States wants to get everybody vaccinated sometime in July. So, you've only got about 3 or 4 months to get there, so 3 months or so. So I don't know what it's going to take for the state to get us more vaccines or to get a federal site, but we're going to need more if we're going to meet the goal of getting everybody vaccinated in July.
We are, and we continue to fight every day to make that voice heard in unison, because we have wonderful administrators and volunteers and folks that are getting the vaccine out, going to door to door in some cases, and we need help from our federal and state partners to get us more. I want to also note that today, Judge, we were on our daily call, which we have been doing now throughout this pandemic. It was our 365th call, 365th situation report. So that's how long this pandemic has gone on. And as we have seen, it has taken quite a human toll on us in our community. But we want to thank you, residents, family members, business owners who have been doing their part to save lives in our community. It has made a difference despite how difficult the year has been. And we can see this light at the end of the tunnel. Let's get there together. Continue to do your part. We do want to remind you that the help is available here in our community if you're struggling to pay rent or mortgage. There is an emergency housing assistance program available by calling 311. You can also get more information at covid19.sanantonio.gov. Also, if you are out of work without an income and you would like to train for jobs that are available in our community today that are unfilled, that need you to work them if you'd like to, you can enroll in our training program, and you will receive a stipend while you train to make ends meet. You can get more information by calling 311 or enroll at 210-224-HELP. And as always, you can get the latest on COVID-19 in our community by texting COSAGov to 55000 or by going to the website covid19.sanantonio.gov. And again, we do have our public vaccine providers who are participating in a text alert system if you would like to be alerted via text when appointments are available. You can text vaccine or vacuna to 55000. Again, please continue to do your part, mask up, practice social distancing and proper hygiene. Do it for yourself, do it for your family, and do it for San Antonio. Dr. Curie and myself and the judge are available for questions.
What can a person do if the clinic where they received the first dose has run out of vaccines on when they visit the second time, and who can they contact?
So Metro Health is working with all our community COVID-19 vaccine providers. We have a community-wide coordinated effort to ensure that everybody who needs the vaccine gets vaccinated. So if you have instances like this, feel free to call Metro Health, call 311, or our COVID hotline, and give that information. That comes directly to me, and I will be happy to coordinate that. And along these lines, I just want to take this opportunity also to talk to the doctor's offices and providers. If you get a shipment of vaccine from the state that is designated clearly as a second dose vaccine, please do not use it as a first dose vaccine. But if you do that, we run into problems where your practice folks who were administered first doses will not get their second doses. So please read the shipment instructions that come with the shipments, vaccine shipments, and if it is allocated as second dose shipments, please do not use them as first doses.
Now we have a couple of questions regarding the death of Robert Charles Shoemaker, who was found dead inside his Saha Fair Avenue apartment on March 5th. The questions are, were all the evacuations handled by nonprofit organizations, or were city and county involved? Did city or county assure that disabled or elderly people were doing okay and had proper assistance during the storm? Were there follow-ups on these individuals, and how were any evacuations done?
So, as we learned yesterday, the death of Mr. Shoemaker was tragic, and my heart goes out to him and his family. With regard to the timing and cause of the death, that is under investigation now. With respect to the emergency response at Saha, I requested a review of the emergency response procedures at Saha, which is underway right now. And as we learn the results of that and challenges that need to be addressed, I look forward to the report, but that is underway right now.
Search for 2-year-old James Charisse continues. His mother was arrested today in connection to his disappearance. She assures that she gave him up for adoption. Family members fear the worst. Can you comment on this situation?
I don't have information on that case.
Dr. Kurian, today the Community Health and Equity Committee meeting, you mentioned it would take about 20 weeks to get everyone in just phases 1A, 1B, and 1C vaccinated at the current rate. Could you clarify if that's 20 weeks from when we started vaccinations or 20 weeks from now, and expand on why it would take so long given that we have so many people fully vaccinated already?
It's so the data that I had provided was starting today. So effective today, if we were to be at the current level of allocation, it would take us about slightly over 20 weeks to vaccinate all of 1.6 million eligible residents at this time. And the allocation that I was referring to was the allocation just to Metro Health, which is about slightly over 10,000 doses a week.
That's all we have tonight. Thank you.